today. I'm going to be leading it off. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County. I'm joined today by Mayor Tom McNamara from the City of Rockford and Chairman Frank Haney from Winnebago County. We're starting out today a little bit to talk about the data around you. We've had a couple of days to kind of hear about the Governor's Restore Illinois plan, in which he introduced a phased-in approach to restore Illinois based on public health metrics. So I wanted to go over some briefing on what those public health metrics are and how you might see those changes in the reports that we'll be issuing. So first of all, there were three main public health metrics that they wanted to look at. One was the admissions data for hospitals. And those were individuals who present to the hospital with COVID-like illness. For those of you who watch our flu report, we call it influenza-like. We now have a new one called COVID-like illness. And that is tracked through emergency departments and inpatient centers. Unbeknownst to the healthcare providers that are doing their care, it's an electronic feed that gets automatically reported. And again, it's through that data systems that gets pulled from, it's in a system called Essence, which is designed to do syndromic surveillance. And it looks at what are the surges and capacities of people presenting to hospital data is like. The second key component is the testing data. We've spent a lot of time over the last couple of weeks, and I'll spend some more time today talking about the test data coming out of our locations. Test data we've talked about are reported through the electronic laboratory reporting systems, another acronym called an ELR. And again, it comes through the state, drops through a system called INEDS to the local health department, and positive rates are based on total number of tests that are positive from total number of specimens reported through the electronic lab reporting. And the third kind of data point are looking at hospital resources, which are called daily census counts. And they're looking at this report through a system called EM Resource that is really captured at the hospital level through another data reporting system. And so while we provide you with local data, we want to be clear that those data systems all report up to the statewide system. So when you're looking at different state reports, it's all of our local data rolling up into these systems. So we are not making up the metrics that are part of this. It is part of a standard data collection throughout the entire state that every hospital that reports through, that every lab that reports through electronic lab reporting, it's all going up to that same place. So one of the things that you're going to talk about, we talk about this phased-in approach, I hear about is when you look at data, and I got a call about why are numbers different? Well, you have to look at how they're talking about regions and why a regional approach. So one of the issues and concerns is, when we talk about this, can we exist as an individual entity, as a city, as a county? Well, we know we've got a lot of cross-traffic across county boundaries, across municipal and local municipality boundaries for work, for play, for pray, for socialization. And so it really becomes important that we understand that one region really cannot stand alone, or one community cannot stand alone. And I know the chairman spoke to this earlier this week. And again, when you look at the region, Winnebago County is what's called North Central Illinois region. It includes two regions, which is really devised out of the emergency medical services regions. Region 1, which is our typical, what we would think of our 9-county region on the state line up here. And then we have an additional region, Region 2. So overall, there are 27 counties in our region. So they are looking at all those metrics as they roll up. So it really becomes important to understand we're trying to provide you your local county data so you can see how it goes and rolls up to the larger region data. Because if you look at this approach, we're really trying to work as a total region and team about how do we become in this Restore Illinois. For those of you who know, we're currently in phase 2 called flattening the curve. But again, I think most of us are looking, what do we need to move forward to the next phase? And I want to say it's not a hard stop and start. It's really kind of a more, I'm going to call it kind of a motion that we go from phase to phase. It's not a hard stop and start into another one. But one of the areas we talked about is cases and capacity. So this looks at our positivity rate. We want to be at or under 20% of that positivity rate and increasing no more than 10 percentage points over a 14-day period. So let me break that down in plain English for everybody. So I've been reporting out your positivity rate, and we've been below the 20%. And if you remember those first graphics, our goal was really, we knew that our systems would have the capacity needed if our infection rate was below 20%. And at 10 percentage point would be if we suddenly spiked. That's that term about watching for those outbreaks that we have to be concerned about. And 14 days is the incubation period that we understand today with the information that we have today about coronavirus. So we're watching that positivity rate. We want to make sure it's not increasing or spiking over an incubation period. Then the second thing we want to make sure is that there are no overall increase in hospital admissions for COVID-19 for 28 days. So that's a 2 incubation period. So over 2 incubation periods, we're looking, do the hospital admissions go up? And so where are we getting that data from? We're getting it from, remember I told you where you're getting it from, for the emergency department data that's feeding out of the electronic records in all of our hospitals throughout the state and the region. Then the third thing we're going to look at is the available surge capacity. A minimum, they're saying now 14% of our beds in the ICUs and medical surgical and the availability of ventilators has to be there so that if we surge, that we can quickly then be able to care for individuals. So we look at all those metrics going forward. So we've been providing you the daily bed count. We've been providing you with the number of ventilators. We've been looking at our positivity rate. We've been looking at the number of people that test positive, as well as then understanding where we move to the next phase. Then the other part is this tracing. We've been calling it contact investigation. We now know throughout the nation we're using the term tracing, and they want our ability to contact, trace, and monitor within 24 hours of the test result. So we at Winnebago County Health Department have been able to surge and have been able to do that with support of our Medical Reserve Corps, which are volunteers. A lot of them are out of our College of Medicine and our other university areas that have been able to assist us in this process. So we can definitely do that contact tracing and monitoring within 24 hours. But again, if the numbers were really high, that's when systems can get overwhelmed, whether it's the hospital or whether it's the health department being able to monitor. Then the other point was the testing. We've been talking about testing from probably about day one on this, right? The lack of availability of testing, what kinds of tests do we have out there, how long does it take to get a test result, who can get tested. The availability of testing has to be for all patients, healthcare workers, first responders, and people with underlying conditions, and residents and staff in congregate living facilities. So there has to be widespread testing capability. It can't be limited. Because again, if we need to quickly identify where those outbreaks are occurring, we need to have that testing capability. So kind of leads into our next discussion about this testing and what you heard about over the last couple days. I think our community has understood the importance of testing, and to date, there have been over 8,800 tests done for our community, which really represents approximately close to 3% of the population of Winnebago County has gotten tested. We've been fortunate to be able to stand up 2 community-based testing sites. One through the Auburn High School, staffed up by Crusader Community Health, and the other at the University of Illinois College of Health Sciences campus, and that's staffed by the Illinois National Guard under the Illinois Department of Public Health. And we are thankful for all of those partnerships. And you may have heard or read about some issues that we had at the community-based testing site at the University of Illinois College Health Science campus. And it had to do with the state and their agreement with the lab that they brought online to do the testing. That was a new lab, and the difficulty they are having is on that electronic lab reporting that I talked about, that ability to get those lab results reported to us. I want to assure the public that those lab tests, we have a manifest, meaning a listing of everyone who's been tested. We have the test number that went with that, and we have been working with that lab to at least get paper copies as quickly as we can. But we all know paper copies take a lot longer than electronic reporting. So in the meantime, what you saw yesterday, as we said, we've got to determine whether we can get those tests sent in collaboration with Illinois Department of Public Health to another lab. And Illinois Department of Public Health made arrangements to now send those specimens to another lab who has demonstrated what we call that electronic lab reporting capability. So I really want to reassure the community that your tests are not lost. We have the manifest of all the tests that were done there. We are going to be working to get those results out on paper. That there is another vendor that they have contracted with called Centene, which is part of the Illinois Medicaid managed care provider group that's working to help notify patients of the results, but we at the health department will also be reaching out to everyone who has had a test from that site once we have those results in hand. If the public has any concerns or questions and wants to know or wants to confirm that we have them on the list, they can certainly email us at covid19@wchd.org or call us on the line, the telephone line. We will take your name, your number, the date of the test that you had it done, and it's been amazing. If you give us the approximate time, it makes it really easy for us to go to that sheet and tell us, then have us be able to confirm that we will be looking for that test result. I know that this is very stressful for many of our population who went to that testing site and have been waiting results. We understand that some people have been notified of positive test results and have then obtained the necessary medical care. But you can understand from that standpoint, remember I talked about the importance of contact tracing within 24 hours of a test result. The longer those test results sit out there, the harder it is for us to assure that we can then stop the spread in the community. So we were very concerned about this issue and worked very hard with our partners at Illinois Department of Public Health to get this resolved. And so we appreciate all of the efforts from the Illinois National Guard, Illinois Emergency Management System, the Governor's Office, and the Illinois Department of Public Health to resolve this issue. And I also want to make sure that the public understands the University of Illinois and the Winnebago County Health Department do not have these test results readily available at this point in our offices. As soon as the health department receives those on paper format, we will be calling and reaching out to all of you. We've been asked, do I need another test, right? Should I get another test? If you are symptomatic and continue and your symptoms worsen, please seek medical care after consulting with your provider. You may need to have another test done so that we can promptly identify and get you into the level of care that you need. So again, kind of coming back of why the importance on the testing, we have to be able to have that as a community, be able to quickly identify, and that testing capability has to be present for all of us. So as we're moving through and we're trying to help us out the community understand, right, I've been pushing out data and trying to include, we are modifying our daily report. Some of you have already noticed and emailed me and said, why are we changing, what are we doing? And we wanted one to include all of the metrics that the governor's office and all, the state of Illinois is looking at in order us to move through those phases. I can't get all of the regional data, but we can at least do some comparison against the state side and our regional data. But we are also doing some additional information. Date of illness onset, you'll find this very interesting. And when you see that report today, I want you to take a look at date of peaks around April 10th and April 13th. And I want you to think about what was going on at that timeline. Because we have another holiday coming up that I know many of you will want to celebrate. Please be cautious, please be aware that those are infection peak potentials. And this is when we were shut down. So understand, we have had some outbreak and peaks in infection rates, even when we've got the stay home, social distancing, and all of the other protective measures we've put in place. We also now have a report of percentage of deaths by location of concern. This has been growing because people ask more and more about this. You see on the state website from all the different, we call them locations of concern, includes both our congregate and our skilled nursing facilities. We are also reporting out deaths by race and ethnicity. We want to make sure that we're addressing the issues around health disparities and health equity concerns. COVID-19 cases and deaths by age are now combined into one graph so that you can see them for comparison. As well as communities of concern, which are our zip codes, and you'll see them done by rates. Someone called and said, well, can we have the actual numbers? The rates allow you to compare. We do a correction for 100,000 population. We know that most of our communities do not have 100,000, but it's a way to relatively compare one zip code with another so that you can see where those are at. We've also starred those ones who have what we call congregate living facilities in which there have been outbreaks, because we know that will drive that number up. So look for those changes to come, because again, we think it's important not just to report out numbers, but to understand when we're getting ready and preparing to move through the next phase. The impact of the activities and actions that you are taking, whether you're limiting your trips out, you know, we're getting a lot of people saying, can we have a celebration for Mother's Day? Can we go and do this? Can we have more than 10 for that? And I want to come back and say, take a look at those peak dates. We are not, there are dates when people, I know, we are all angsty to get out, but again, you're protecting yourself, you're protecting others, and you're protecting the community. Look at our highest rates of infection and where they're occurring right now. We've talked about this before. Then the age ranges of 20 to 29 and 30 to 39. We understand that these are the individuals most likely to be out in the workforce and out moving about. So please think thoughtful about this as we move forward, even through these phases, because we don't want to have to ever step back. We only want to keep step forward. Today, we're reporting an additional 52 cases of COVID-19 from ages under 1 year of age through an individual in their 80s. This brings our total case count to 786. We are also reporting an additional 4 deaths to a total of 26 deaths. Once again, our sincerest sympathies and condolences to the families of our Winnebago County residents who have died. Total recovered is 172, which represents about 22% of our positive cases. And again, reporting recovery takes so longer than reporting new tests. And I often hear, well, can I just count back 21 days and say those individuals are recovered? And the answer is no. We actually follow those through. Person day 1 that their test comes back positive may be fine, be recovering at home. Day 5 may require hospitalization and then may require an extended stay in the hospital beyond. So we are then constantly in contact to find out when that individual is being discharged. When did they become asymptomatic? When have they returned and are fully recovered? So it's not just a simple, 21, 30 days, count and done. So every day we look at those. And so some days you may see no change in the numbers of recovered, and other days you may see more recovered. New locations of concern include Lincolnshire Place, Rosecrans, and the Atrium. These are, again, they have self-identified. They have also notified all of their staff and personnel, as well as the members and residents in their communities of that. That is a requirement under the Illinois Department of Public Health. And what we call our long-term care facility strike force team that looks at congregate settings has also been in contact to support them in any way that they need support. To date, 155 of our laboratory confirmed cases have been in congregate settings. This is similar to what we're seeing throughout the state. Those congregate settings are at the highest risk for outbreak. And so when we identify, we are quickly working to test the staff, monitor, and then put enhanced monitoring around the patients and or the residents, depending on the setting, so that we can quickly identify any individual who becomes symptomatic, get them tested, and get them into the right level of care. So wanted to bring you up to speed on some of the data that we're looking at, where we look at the Restore Illinois plan, and where we're moving in terms of Winnebago County. It's, again, I think the community has done a lot of work around this. We've kept our infection rate below 20%. We've had a few little blips that we probably need to take a notice on and work on, because we are moving to Restore Illinois. We want to move through our phase. We want to be able to begin to bring our businesses and some other areas of activity into recovery with us. But we need to be vigilant. We can't step back now, because if our numbers go up, you've heard what the benchmarks are, then we may have to step it back as well.